Okay, this video is about electroconvulsive therapy called ECT, sometimes called electroshock therapy. This is used most often for treatment of severe depression. Most of the information in this book is going to come from, this video is going to come from this book called Brain Disabling Treatments in Psychiatry by Peter Breggin MD. He's a Harvard-trained psychiatrist known as the conscience of psychiatry. And electroconvulsive therapy, ECT, common treatment, most common patient are old women. Older women, they're the ones who get it. They get sent to the electric chair, literally sent to the electric chair. It's amazing this is still happening. You know, that's why you always have to laugh, because you're going to hear a lot of people try to BS you. Oh, everything is based on science, peer-reviewed literature. BS. You don't have to be a genius. It just takes common sense. You don't randomly run electric shocks into somebody's brain. It's insane. It really is. You don't be a fool or a chump to believe anything anyone tells you otherwise. Randomly running electric shocks into people's brain, so powerful that the patient has a seizure induced. That's an expected part of the procedure. It's crazy. And how come other psychiatrists don't speak out about this? And I'm also going to be, for the sake of disclosure, my father was a psychiatrist, and he once told me, the reason, because I asked him, I go, Dad, that sounds crazy. And he goes, well, it actually works surprisingly well, and it helps to lower the risk of suicide in patients with severe depression. That's why they do it. And so in his experience, he thought in some patients it was beneficial. And at the time, I took that as a reasonable response. But now that I'm older and I know a lot more than I did when I was a young doctor, I think that's BS. And I think what happened was my dad was a good guy and he meant well, but I think he just accepted conventional opinion in his own field. If the journal coming from, the famous hospital said that ECT was appropriate in such and such a situation, then he would do it. I'm different. I might be an egomaniac, narcissist, arrogant, whatever you want to call me, but I trust my own brain, and most smart people do, and this is BS, okay? Breggin claims that a substantial amount of permanent brain damage and lowered IQ and memory deficits are characteristic of ECT therapy. Now, if you put a patient on a medication, even an antipsychotic, you have this hope of recovery, even though there certainly is some permanent brain damage. But with the ECT, you got less of a chance, you would think, from an electrical injury of recovery than you would from a chemical injury of an antipsychotic. It, of course, depends on how long they're on the medication, what dose they're on, what other medicines they're on. There's a lot of variables, that is true. But I'm just saying, randomly putting electric shocks into a person's brain, it could be unilateral, it could be bilateral, it's still bad. Breggin specifically says, I put page numbers for everything. All the page numbers are from this book, so you can look this all up for yourself. There's tons of research papers, too, showing all the problems from ECT. Breggin says it's an electrical lobotomy. Make no mistake about it. This is an electrical lobotomy, essentially an electrical lobotomy. Breggin claims that in comparison with sham ECT, like a placebo equivalent, ECT has not been shown to be beneficial. Breggin claims that also ECT has not been shown to lower the suicide risk. He says it even has in some studies been shown to increase the suicide risk. He says eventually the patient partially recovers from their acute electrical injury to their brain, and then now they still got whatever emotional problem they had before, but they have less brain capacity to handle it, and perhaps with more repeated, they'll even keep repeating them over and over and over, multiple treatments, till they're so brain damaged they can't even remember their problems that well. It's frightening, okay? Breggin points out the brain is much more complicated than a TV set. But you wouldn't think a TV repairman was within their right mind if they started randomly applying powerful electric shocks to your TV set until the point that it was inducing a seizure. Crazy. Breggin said some husbands commented that they liked their wife after ECT because she didn't complain so much. Some writers have claimed that Ernest Hemingway got brain damage from ECT and that made him so miserable that he committed suicide. But that's a controversial statement. And the reason is Others will say that Ernest Hemingway, he was a football player in high school. He was a boxer in high school and a little bit afterwards. He had concussions in World War I and World War II. He was an alcoholic. He was in a plane crash in Africa in 1954. And supposedly he was trapped in the plane and he battered his head against the door to get out. And then he was an old man at sea in his fishing boat and he fell down and he hit his head. So I think it's a fair statement. Hemingway had plenty of reasons to have, they thought he maybe had chronic traumatic encephalopathy, but certainly he did get ECT and he went downhill after that. So perhaps he just had a much more vulnerable brain. It wasn't the ECT alone, but it certainly sounds like it didn't help him. Another study in Breggin's book showed a study where the ECT patients were dying significantly sooner than the non-ECT treated patients. We saw with the antipsychotics, the ones treated with antipsychotics on a continuous chronic basis died sooner than the other patients. So, look at this treatment. The patients get brain damage, have memory impairment, have lowered IQ, they die sooner, it doesn't improve their suicide risk. Why do it? Breggin says the patients usually don't get what he would consider a fair informed consent. They're not told about all these problems and negative studies about ECT. They're often sort of pressured into it. Another thing of note, I grew up in the old days where, Russia was a commie shithole, okay? We just had no respect for the place, and I know a lot of Eastern Europeans and nothing but disgust at Russia of the 1900s. And the reason I tell you that is because a study amongst Russian scientists, they felt ECT was such a bad thing after looking at the brain damage it caused in animals under a microscope that the Russians thought it should be banned. Now, that's saying something. Breggin says that ECT, it doesn't work for depression. It increases suicide risk. It causes permanent, substantial brain damage. In his opinion, it should be banned. And I'm certainly no expert on it, but from the little bit I know, I would agree with him. I think that I can't see a justification for this. It's not effective, and it has so much comorbidity with it, permanent brain damage. I would never allow somebody under my guidance to undergo this procedure.